Good afternoon, fellow Rotarians, and welcome to the Rotary Club of Gainesville meeting at the Cade Museum. Please remember to silence your cell phone, and if you're watching via YouTube, please register your participation by sending an email to info@rotarygainesville.org. And now please welcome Pete Inwall to the podium for our song and pledge.
This Sunday I had a chance to visit a different church, and so it was sort of a quasi-Pentecostal Baptist type church, and the preacher gave the sermon. He said, "My friends, this church is like a little bitty baby, and first it's got to learn how to crawl." And the congregation yelled back, "Let it crawl, Rev, let it crawl." He said, "When this church learns to crawl, then it's going to have to stand up and learn how to walk." And the congregation yelled, "Let it walk, Rev, let it walk." And then he said, "And when this church learns how to walk, then it's going to have to learn how to run." And the congregation yelled, "Let it run, Rev, let it run." And then he said, "After this church learns how to run, in order for this church to run, it's got to have money." And everybody yelled, "Let it crawl, Rev." Join me in pledging allegiance to the, well, let's see, we got to sing the song first. "My country 'tis of thee. My country 'tis of thee, sweet land of liberty, of thee I sing. Land where my fathers died, land of the pilgrim's pride, from every mountainside, let freedom ring." Join me in pledging allegiance to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Pete. And now for our invocation, Ernie Hull.
Well, I'm no Laurie Vidal, so I'm not going to start off with a joke. There you go. Thank you very much. I don't need to start with jokes, do I? Let us pray. Lord, we thank you for the amazing power at work in our lives. Thank you for the goodness and for the blessings you pour over us. We thank you that you are able to bring hope through even the toughest of times, strengthening us for your purposes. Lord, today we are mindful of the dreaded disease of cancer and the lives that are cut short by it. We have all seen friends and loved ones devastated by this scourge. We pray today for the University of Florida's clinical trials team. We pray for all those who are on the front lines who are searching for a cure for this dread disease. We pray that the answer is just a heartbeat away. We trust, God, that you will provide the answers and the cure. We thank you again for your great love and care. We thank you for the food that has been blessed to our bodies. Renew our spirits, fill us with your peace, hope, and joy. Now, Lord, bless our meeting today. We pray. Amen.
Thank you, Ernie. You may be seated, but if you're a guest or visiting Rotarian, please remain standing to be introduced. We'll have a microphone coming around. Kick us off, Gordon.
I'd like to introduce my son once again, Steve.
Hello, Rotarians. My name is Craig Carter, and today I get the privilege of introducing Free Johnson. I met him when I was in City Commission in 2014, and I'm honored to say, and I already paid my $5, he is running for City Commission, so take your time to get to know him. Great man, great candidate.
Hi there, my name is Brett Buell. I am with the Rotary Club of Downtown Gainesville and will next year be serving as president of our club.
I'm Marion Colburn, very proud to introduce my friend Judy Young, who is visiting me from Sonoma, California.
I'm Davis Rembert, and I have a table full here. I have my brother Thomas, his wife Nancy, Anita Rembert, Belinda, Ken, Gloria, Garrison, and Don Patrick. He was here last week. And me.
Hello, fellow Rotarians. Today we have a number of guests that came with our speaker. I'm going to pass the microphone to them and let them introduce themselves.
Hi, good afternoon. My name is Dan Hoffman. Also, I work with the Cancer Center. Just happy to be here.
Hi, everyone. Thank you for having us. I'm Jamie Hensley. I am Assistant Director for Healthcare Administration with the UF Health Cancer Center's Office of Community Outreach and Engagement.
Hi, Erin Minari, Administrative Director for Clinical Research at the Cancer Center.
Hi, everyone. I'm Jennifer Woodard. I'm the Director of the Office of Community Outreach and Engagement, and we're really happy to be here today to talk to you all about some of the work we're doing at the Cancer Center. Thank you very much.
Welcome, everyone. It's a pleasure to have you join us today. And now, with us starting off the month of May, we're going to celebrate May birthdays. And as Pete is leading us in the birthday song, please bring your dollar to President Linda. And as a reminder, the dollars go to our Santa Fe Reading Safari program. So birthdays for this month: Patty Chapman, Doc Coker, Mike Conroy, Philip Crutchfield, Rob Dees, Wesley Eubank, Marcia Eubank, Nancy Hart, Buddy Irby, Ryan Crimser, Susan Maston, Shane McIntosh, Jolene Miller, Lisa Mueller, Don Robertson, Dominique Scorpio, Harry Shaw, Bill Stasewicz, Tom Summers, Marianne Westfall, and Doug Wilcox. Happy birthday, everyone. Pete, take it away.
You want change? Pizza Bill, you want change? No? All right. We're going to sing Happy Birthday with gusto. Ready, maestro? Happy birthday to you. Happy birthday to you. Happy birthday, fellow Rotarians. Happy birthday to you. And many more.
Thank you, Pete, and happy birthday, everyone. And now, in honor of Mother's Day, please welcome John Gregory to the podium.
This one is called Wedding Bells. One tough thing about women, they will go out on a whim, get excited about something, it's all about nothing, and then they go out and marry him. Shank loved his mom, no doubt, even when she chose to shout. Although she had the book, she really couldn't cook, but she was good at dishing it out. A good mom with kids are nursed. Kids like the beaters do thirst. However, to become a truly great mom, always stop the beaters first. Greg's wife wanted some knowledge. Pregnant, she deserved truly a pledge. When will the baby move? Greg wanted to prove. Hopefully, right after he leaves college. Happy Mother's Day.
We can always count on you, John. And now for an announcement, please welcome Brett Buell to the podium.
Hello, everybody. The Gainesville Opportunity Center helps adults living with chronic mental illness get back into the community and lead meaningful lives. Thank you to my fellow Rotarians for sponsoring our third annual Bike Day, which is taking place on Saturday, May 18th. Registration is at 8:30 and the ride starts at 9. There's 3 distances to ride, and the shortest is short enough that you can even walk. After the ride, there will be music and food. Other Rotary clubs and Rotarians are sponsoring the event. We hope this will be a nice social event for everyone. Hope to see you out there, and thank you so much for your support.
Thank you, Brett. And now, at this time, I'd like to bring Davis Rembert to the podium. Please welcome.
Hello again. I had 2 recipients last week, my daughter, Mary, and my good friend Don Pagic is back here taking a video. But you know, Paul Harris, I go back 50 years listening to people give Paul Harris Fellows, and that's been a whole lot. I just want to remind you, it was founded by Rotary in 1957 to recognize individuals who sponsored teams going above and beyond in their achievements with their family, their church, and their community. It is Rotary's highest award. So my first recipient is Gloria Mells. Gloria has been in our household for 52 years. I haven't told the kids, but she's written a book. So Gloria was raised in Newberry on her grandparents' farm. She attended Newberry Elementary and Middle Schools and graduated from McBain High School in Alachua. That's a school right near us. You pass every Monday. And she is one of 11 children. She's been active in her church all her life, and along with her husband, Darrison, raised 4 daughters. How many grandkids? 10
9 great-grands.
10 grandkids and 9 great-grandkids. I have 1 great. Judy's soon to have 2 greats. So, Gloria, we want to present you with this plaque and this pen in honor of you being a Paul Harris Fellow with the Rotary Club of Gainesville. You're good for that. My second recipient is my brother Thomas. Thomas Jonigan, remember, 13 years younger than I. Thomas came to live with Judy and me when he was only 10 or 11, I don't know, upon the death of our parents. So you might say that we raised each other. Thomas ran his own convenience store for years on University Avenue across from a Coca-Cola plant. He then built a chain of Jiffy Lube stores in Gainesville, which he sold a number of years ago. He retired, and his passion is traveling in his RV all over the country. He and Nancy, literally, I mean, he's been here months on the farm, and they live in that little old RV, and we got that big old house, but they love it. And so he and his wife Nancy have a home in Loveland, Colorado, 20 minutes from his daughter Becca and his granddaughter Zoe. So they're headed back out next week, I believe. So Thomas, we'd like to present you with this plaque and pen and honor you as a Paul Harris Fellow. Yes. Thank you. Next is my Davis McKendry Rembert III. Ken. He attended Buchholz High School, graduated in the University of Florida with a degree in forestry. He went to work for Nakusa Packaging in Lake City. After he got tired of the chinch bugs and bed bugs and ticks, He came to work for Sprint Food Stores until I sold out in 1988. He then bought and still has, after 21 years, the Bagel Bakery. Suspect everyone in this room knows where that is, in Millhopper Shopping Center. Several years ago, he branched into real estate. He began working with Saunders Realty in Lakeland, Florida, selling farm property. He sold the farm right next door to us, and we got a great person. He's from Australia, and she's from Italy. 2 daughters, and expecting another one. So he did well. Never know who you're going to get for neighbors. So Ken has received his Paul Harris Fellow years ago. Belinda found it, and I framed it. But he now gets a pen with a sapphire in it. So here's your Paul Harris Award again. Thank you, my friend. This is my youngest son, Jonathan Creighton Rembert, who is home in bed sick with the flu, and his lovely wife, Anita, has come all this way to accept his plaque. Jonathan is 7 years younger than his brother, Ken. He graduated from Gainesville High School. For years, he devoted his career to home construction until I bought Rembert Farms. Then he came to work for me as my farm manager. Jonathan has all started in a venue at Rembert Farms for weddings and special events, and probably most of you have been out there for some sort of event. For a number of years, he sponsored and put on the annual Swamp Dash race, a 6-mile event with very challenging obstacles, such as crawling on all fours in muddy water under barbed wire. That is just one of them. Then jumping over fire, you name it, they did it. And people pay big money to do this. So this event, which took place at Rembert Farms, has been replaced with the annual Savage Race. If you ever get a chance, it's so much fun to come out and see. People come from all over to do this, and it's just a great thing. So Savage Race, it's locally owned, but they have events all over the East Coast. On top of all this, Jonathan has continued running his company, Start to Finish Race Management, which times hundreds of races and numerous racing events. So to accept his award is his lovely wife, Anita. Anita, if you would present this to him, I present it to you. We appreciate it. We love you being in the family. Thank you. So thank you very much.
All right, thank you, Davis, for making those presentations. All right, we have some great speakers today, but I do have some announcements. Before I make my quick announcements, however, I have the unfortunate responsibility to let everybody know that we lost a member last week. Charlie Palmer, many of you may have remembered, was instrumental in our feast and for many, many years. And so he passed away last Thursday in hospice. And so we will take a moment of silence and recognition of Charlie and ring the bell in his honor. Thank you. Moving on, again, reminder, next week we are not here. We are at the new event center in Celebration Point. We'll be sending out email reminders, but please, please, please don't come here next week. We'll be at the event center for the youth speech contest. So if anybody has any questions or concerns where that is, let me know, but we'll see you at the event center next week. And as I mentioned, the staff is willing to, looking forward to giving tours after our meeting if anybody wants to stick around and have a tour of the new event center. Also this week, please look out for an email from me We have a speaker coming up in June with Are You Motivated? And she has requested that we fill out a survey that will help her guide her presentation. So I'll be sending out an email with a link to that survey. If you can take, it takes less than 3 minutes to fill it out, and it will help her with customizing her presentation to the audience. So I'll be sending out that link as well this week. This past weekend, a number of the club members went to the district conference over in Jacksonville. Myself, President-elect Ryan, Jacob Atem was there, Jay was there for some of the training. Again, we had a great time. Brett was there from the downtown club. We had a great time learning about Rotary, hearing from inspiring speakers, and having a chance to network with each other. So again, it was a great time, and I highly encourage anybody to take advantage of that opportunity in the future. Also wanted to remind everybody that RLI is coming back. Rotary Leadership Institute is coming back to Gainesville. August 10th, it'll be at the Blount Center. Registration is open for that. So I highly encourage everybody to take advantage of that training opportunity. It's a great way to learn more about Rotary. If you've never done it before, the fact that it's in Gainesville this time is a huge bonus for us. And of course, we want it to keep coming back to Gainesville. That way we don't have to travel to it. So we need everybody, as many people as possible, to take advantage of the fact that it is here, as opposed to having to travel to another area in the district to take advantage of that training. So again, registration is open, and hopefully I encourage you guys to apply for that opportunity. The last bit of business that I have is we had the speakers from the Luby Bat Center last week, and we talked about doing a tour. I did want to let everybody know we looked into it. The cost is $50 a person. So before we pursue doing that, I was just kind of wanted to, if anybody's interested in me pursuing that, please come over and see me after the meeting. It seemed a little steep. We were a little concerned about trying to coordinate something and then not having a showing. So if you are interested and you think $50 is reasonable, I'm happy to continue trying to set that up. But we just we didn't want to do that, but we also didn't want people to think that we were not interested in that tour. So with that, I'm going to bring up Lisa to introduce our speakers.
Thank you, everybody. I have the pleasure of introducing our speakers today, Dr. Erin Minari and Ms. Jennifer Woodard. Dr. Minari is Administrative Director of the Clinical Research Office at the University of Florida Health Cancer Center. She joined in 2018 and supported the growth of the clinical trials and by developing U of F physician investigators. In this role, she created a team of project managers that oversaw a nearly 64% increase in U of F developed cancer clinical trials just in her first year. Ms. Jennifer Woodard is the Associate Director of Clinical Research and serves as the Director of the Office of Community Outreach and Engagement at the University Health Cancer Center. She has over 15 years of experience in clinical research and community outreach. Jennifer is deeply committed to improving health outcomes and promoting equity in healthcare services. Please give a warm welcome to our speakers, Dr. Minari and Mrs. Woodard.
Thank you so much, Lisa. Hopefully that volume's okay. If anyone's having trouble hearing, please give me a symbol or a sign, and then we can move it closer to my mouth. Let's see. So this slide, this is myself and Dr. Minari. We just want to let you know we have no disclosures to declare. Power switch, thank you. We'll get there. Okay, so thank you so much for having us here today. As Lisa mentioned, I'm the Director of the Office of Community Outreach and Engagement. We have a team of about 16 individuals who are tirelessly out there in the community, boots on the ground, really making sure that individuals know how to access services and access research and just some of the work we're doing. So I want to go through kind of a brief presentation, and then I'll pass it to Dr. Maneri to talk a little bit more about clinical trials. So as you can see here, this is our mission at the UF Health Cancer Center. We do patient care, we do research, and we do education. Those are our primary missions at the UF Health Cancer Center. Cross-cutting those three aims, we have the importance of community outreach and engagement, which is another mission that we have, diversity, equity, and inclusion, and then doing policy and advocacy. Part of community outreach and engagement, and I like to just set the stage with this, the intention is for those services at the Cancer Center that can be received in the community, we like to bring them to the community. This idea that you shouldn't have to cross our threshold to get the services that are available. Of course, there are some services that you have to go to the Cancer Center for, but not everything. So we'll talk about those today. Our work is based on the National Cancer Plan. This is created at a federal level, and then it is trickled down, and there's a state version as well, but they have a lot of overlap. The principle is there's inequitable health outcomes that are the result of both historical and structural issues that have created and perpetuated disparities in cancer outcomes across every stage and aspect of cancer care, from risk factors through treatment and survivorship. So, you can see on these icons here, these are the elements of the National Cancer Plan. We have focuses around health disparities and equity, raising awareness, promoting early detection, which means getting screenings regularly, educational programs, and collaboration with community organizations, such as this, and mobile health technology, and of course, evaluation and impact. And I meant to say this when I first came up. There's a couple of slides that I will breeze past pretty quickly because I know our time is limited. I included them so that you could reference them afterwards if you want, like some information slides. So I'll let you know when I get to those. So this describes the continuum, what they call the continuum of cancer. And when we talk about the continuum of cancer, we talk about etiology, which is some of those genetic risks, environmental risks, exposures, so the development of cancer, through prevention. So how do we reduce risk factors, around healthy weight, smoking cessation, things like that. Detection, which means getting your screenings and identifying cancers early so that it can be treated, all the way through survivorship. So when we think about the cancer work that we do at the Cancer Center, it crosses all of these phases. We were recently awarded NCI designation, and I want to tell you a little bit about what this means. This means that the UF Health Cancer Center was recognized as leaders in developing and translating scientific knowledge into new treatments. We also are noted as serving our local communities with unique and tailored needs in our populations, and then disseminating evidence-based findings. The whole premise is what we learn at UF needs to then be translated to patient care or in the community. The idea that we need to get that information out there, and we were recognized for that. There is a video here that you guys can go back and look at afterwards. I won't play it now for time. So I want to talk a little bit more about the Office Community Outreach and Engagement specifically. At a high level, we have three aims. The first aim is to know our communities. We serve 23 counties, so think Ocala North and through the Panhandle, through most of the Panhandle. So that's sort of what we call our catchment area. So what this means is we need to understand our data about the cancer burden, but this also means we need to explore and understand the perspectives of community members. So all of that is what we talk about when we say we want to know our communities and know the cancer burden. We also engage the community as partners, and that partners piece is a really important word there. This idea is that we work with communities to co-develop solutions. We don't come in and say, hey, we've got the solution for you. The idea is how can we work together to foster these partnerships? And then our third aim is to enhance the impact of research, the research in partnership with the community. So making sure that research is accessible to everyone who's interested in participating. So I want to talk really briefly about this idea of outreach versus engagement, because they sound like two very complementary words, and they are complementary. The idea of engagement is that it is a longer-term relationship. In some situations, you need to have that longer-term community relationship. Sometimes outreach is absolutely appropriate, but it's a little bit more time-limited, it's a little bit more one-directional, outreach is, and the messages tend to be static. Whereas with engagement, what we talk about with that is creating relationships, co-developing solutions, having tailored and dynamic messages. So when you hear of the work that we're doing, we spend a lot of space in this engagement realm. Okay, so this is an engagement continuum. And at a high level, the idea is that the more relationship you facilitate with the individuals you're serving, you have increasing levels of trust and impact. So at level 1 is that outreach, right? We just talked about that. That's that one directional kind of transactional, time limited type of engagement. And like I said, it's appropriate in some settings and we do it sometimes. All the way over to shared leadership, which is sort of the most extensive level of engagement. And that's when we really co-develop projects and resources. And we try to do a lot of this in the work that we do at Community Outreach and Engagement, is working with communities to develop these solutions. Okay, I want to talk briefly about just our catchment area so that this group understands who we're serving at the Cancer Center. I mentioned it's 23 counties. In general, we have a higher proportion of non-Hispanic white and non-Hispanic Black population relative to Florida and US in general. We are a little bit older and we have higher rates of poverty. We also have high smoking rates compared to the rest of the country in Florida, obesity, and low screening rates. So that's sort of the gist of what the demographic profile looks like of our counties. I also want to talk about briefly something called SEV, so socioeconomic vulnerability. And the idea is that we have a lot of communities within our catchment area that have high socioeconomic vulnerability, which of course is related to things like accessing care and timely screenings and housing issues and food issues. So there's a lot of that gets entrenched in that. I mention that here because at Community Outreach and Engagement at the Cancer Center, we think about the intersectionality of things. So none of us have a single identity or a single factor that defines us. So we think about things like rurality. Does someone live in a rural area? Is there socioeconomic vulnerability? So layering these things on compounds the disparities and compounds the risks, which is why we like to know what that looks like in our communities. We have, this was the SEV slide. Sorry about that, everyone. I want to talk a little bit about our priority cancers. The cancers that we prioritize at Community Outreach and Engagement are those that you can screen for. Not that all cancers aren't important, but when we're doing our outreach, the idea is which can we provide screenings for. Just by way of quick introduction, we have higher rates of lung cancer in our catchment area than both US and Florida, and it is exacerbated in rural communities. We have higher rates of breast cancer than Florida. It is exacerbated in our non-Hispanic Black populations. We have higher rates of colorectal cancer in our catchment area in rural counties as well as compared to Florida and US, which you can see along the top. Prostate, oropharyngeal, and cervical. Oropharyngeal is, they sometimes will also call it head and neck. These last two, oropharyngeal and cervical, are deeply related to HPV infection. So we do also talk a little bit about HPV vaccines in our community outreach. So that's just to give you a sense of our catchment area. Let me go back one. This priority cancers, this is talking about advanced stage incidence. What that means is when the cancer is detected, if it is at a later stage, it is harder to treat. Doesn't mean it's untreatable, it means it's harder to treat because it's more extensive. So the value of screening and doing regular screenings is that you can catch cancers at earlier stages, and treatment is, you have more treatment options in that way. This is just a summary of our priority cancers. So we focus on lung, breast, colorectal, prostate, and those two HPV-related cancers. Those are our priorities, I would say, for community outreach and engagement. We do a lot of work around smoking cessation to reduce risk factors, HPV vaccine and infection, and obesity. And of course, our major driver for how we think about the lens that we do the work is through health equity and social determinants of health. So looking at that intersectionality we were talking about. This is a slide that I'm just going to breeze past, but you can ask for it later if you want. There's a whole report that covers in detail anything else you could possibly want to know about the 23 counties and catchment in our catchment area. So I put a QR code there that you can scan it if you want to learn more about this. Oh, this is exciting. So one of our second aims I mentioned was to actually work with our communities as partners to design interventions to reduce cancer. So the idea is that there's disparities that exist in risk factors, in screening and early detection, in research and treatment, and survivorship. There's just health disparities across those themes. So what we know works well, and this is evidence-based, having comprehensive public health campaigns, increasing access to care, reducing structural barriers, and improving communication between patients and healthcare providers. These are things that we know decreases disparities in cancer. So much of our work is built around this. I'm going to tell you a little bit about Project Continuity. This is something that was developed about 3 years ago at the Cancer Center in our office. And the idea is we are setting up community clinics to do mammograms, cervical cancer screening, colorectal cancer screenings. These are offered on Saturdays because they're accessible to individuals. We provide transportation, language support. The whole premise is to provide education and screening, access to screening services. In the picture, you can see there's a team at one of our events, and then next to it is this gigantic inflatable colon, which is a pretty cool education tool. Yeah, it's a lot of fun. we have an event coming up in a couple of weeks that I'll make sure to share with Lisa, where it'll be present should anyone be interested. It's a really cool way to learn about what does a polyp look like, you know, what does a problem area look like. So that's always fun. We've been doing these clinics for, like I said, about 3 years. We work with community health workers, clinical and social services, and this is only made possible by strong community partnerships. Jennifer cannot roll up into a community and say, hey, let me offer you screenings. This is made possible by social networks. So this is just some of the places we've had some events in the last year. Let me see. We've done over 5,500 outreach events and outreach to individuals. Screened almost 1,000 individuals in 2023. So that's sort of the scope of our work. This is the exciting part. I'm really happy to share. This is relatively hot off the presses. We were awarded from President Sass at the University of Florida funds to develop a mobile screening unit. And what this allows us to do is go to more of our 23 counties. As of now, we've been relying on partners to come in and bring their mammography units, and that's wonderful, but that's a lot of coordination, as you can imagine. So the idea with this mobile screening unit is we'll be able to do mammography. We'll have a primary care room. Oh, there's no pointer. So the mammography is on the far left-hand side, and then there's a primary care room over here on the right-hand side. We'll have a nurse practitioner who can do primary care, because whenever someone enters onto your unit, they're not just there for cancer screening, right? Like they probably also need some other services. So, and in the middle is a lab. So we'll be able to screen for prostate, colorectal, cervical, breast. I mentioned we'd have primary care. We will be able to offer access to trials for anyone who's interested in such things. And I like to just say, in terms of research in the community, you know, we have to approach this thoughtfully because of historical injustices. In general, my thought on making research accessible is I like individuals to have the option for research. And so what we can do is we can bring some research into the community so it's available. No one has to participate in research to get our services. That's not how this works. It's just an availability thing. I put this slide on here. This is just a reminder about the screening frequency. You know, mammograms every 1 to 2 years, colorectal depending on how you do your colorectal cancer screening. So you can refer to this afterwards. This is just reminders for those guidelines. So I'm going to talk now about our third aim, which I mentioned was to promote access to trials, specifically clinical research trials at the Cancer Center. So the overarching principle is how we do this, especially to ensure that we have a diverse representation in our research data. We promote trust. We do bidirectional engagement with community and researchers. They work together to develop proposals. We identify barriers like transportation, costs of lodging, and we, of course, want to enhance trial diversity. This is a description of types of community-engaged research design, and this is actually a framework. This idea of researchers are not over there in the buildings writing their own protocols by themselves. This idea that you work with community to understand what's needed, how to improve the protocol, how to make it more accessible for individuals. So we have a lot of benefits of this, and we have a lot of programs at UF that support this with our researchers. I'll skip past this video, although it's very cool. If you happen to access it, I recommend watching this one about the importance of participating in trials. I want to tell you one last thing that we do, or one last thing that we have available in this space, is we have a program called the Citizen Scientist Program. These are community members who do some training about Research 101 functionally, and then they participate and become members of study teams. So these are often patient advocates, individuals who've had cancer before, and they come and they bring that perspective of the participant. Our researchers love it. Our researchers love it because they get great feedback, and our citizen scientists really love being involved in these studies as well, and they're embedded throughout our infrastructure. Here's some resources we have available to trial participation. This is a program we started this year with Dr. Manari. We provide transportation, food, and lodging to individuals who are getting treatment at the Cancer Center. And then this will be another one of the slides you can come back to. This is a couple different ways that you can stay connected with us and what we're doing. And some of the QR codes for our websites and our socials. So I'll leave that on there. And I think I'm going to hand off to Aaron to talk more about the role of the clinical trial discovery.
Hi all. I'm not used to speaking into a microphone, but hi, hopefully you can hear me. My name is Erin Minari. I am currently the Administrative Director for the Clinical Research Office, which means all of my work is centered around clinical research. That's actually how I know Lisa. Her daughter is one of the project managers she spoke of that I hired when I came on to beef up our trial program, and she's fantastic, by the way. Love her. So I'll be pretty quick because I know we're short on time, but I wanted to give you guys an overview of what those clinical trials mean and what they look like and what kinds of offerings we have. This is just an overview of how treatments come to market. So usually starts with some scientists somewhere. We do have some at the Cancer Center that work at their bench with their mice, and that's not really my world, but that's what they do. Then they'll do some preclinical research in animals that looks promising, then we bring that to clinical research. And that's where we start testing with a small number of folks, and then the next phase will be a larger number of folks, and then another phase will be an even larger number of folks before there's enough data to send it to the FDA, send it to the government, and get it approved for marketing. So really where I'm involved is that step 3 in there. This is what I just described. So just lab studies, and then human safety will just enroll a few people. Those are usually for folks with advanced stage disease. And then we'll move into phase 2 and phase 3, where we're looking first at safety and then eventually into, is this working? As far as trials at the Cancer Center, we have a large number of trials. We consider them treatment, so anything that Jen was speaking about that's available for resources to get to appointments, hotels, lodging, things like that, that's all applicable to clinical trials as well. We consider our trials that offer medications and other treatments part of your care. We do have collaboration among all the colleges at the university, which is really nice. And we do have this NCI designation, which is kind of the stamp of approval from the NCI that we know what we're doing, and we're doing quality, rigorous work. Jen talked about this a little bit, so I won't speak too much on this. But we are the only NCI designated cancer center at a public university in the state of Florida. There are some other NCI designated centers in Florida, but we are the only public university. We go in for our renewal next year, so I'm excited about that. My focus is on interventional trials. The main buckets we look at are interventional trials, where we are going to do something to people and then watch and see what happens to them. That's probably what you often think of when you think of clinical trials. We also have observational trials. So we're going to look at some people who smoke, some people who don't smoke, and then we're just going to watch them and see what happens. See if one group develops disease and the other doesn't. So we're not doing anything to them. We're just watching and seeing what happens. As far as interventional trials, there are ethical considerations. And so we often will give everybody the treatment and then compare it to historical folks who did not receive that medication. It is problematic, clearly, to give somebody who has breast cancer, well, I'm going to randomize you to either get this drug or get nothing and see what happens. That's not something that we do. So there's rarely a control group in these trials. Everybody gets the treatment, and then we compare it to past groups of people that are in the literature and published. There's 3 ways clinical trials come to us. One is private industry, so Merck, Pfizer, someone like that will come to us and essentially contract with us and pay us to run their clinical trial through our clinic. We are picky about those. Our physicians will not accept them if they don't have what's called equipoise, which means they really don't know if it's better or not. If they think it's better, then they should be giving it to everybody. If they don't think it's better, they shouldn't be giving it to anybody. So they're really particular about would I give this to a family member before we run any of those trials. Because we are a member of the NCI, there are trials that come from the government that we can enroll in. We pick those. There's kind of like a menu online, and we go through and pick ones that are prevalent in our community and in our clinic population. And then this last one are UF homegrown trials, where our physicians will go into the clinic and they'll have an idea and, you know, what if I did this? What if I combined this medication with that? And that's where my passion is. That's what I came on board to do. That's what I hired Alex to help do. So what I really find exciting is when these doctors meet the patients, come up with ideas, and that idea will just live in their head. They'll go to bed at night and wonder, what if we did this? Unless somebody actually sits down, goes through the effort of writing it, planning it, making it happen. So that's what I came in and put my foot on the gas to get going. This is our general distribution. So about half are pharma, about half are NCI, a little fewer UF physician initiated. This doesn't add, I'm sorry, this isn't percentages. They don't add to 100, I don't know why. This is the number. So these are interventional only. So we have about 50 industry trials, about 50 NCI trials, and about 42 physician-initiated trials. When I started in 2018, we had 1. So I'm really proud of the program that we built up. These are just common cancer treatments. I know we're short on time. Okay. So these are common treatments someone might come in to get for their cancer, often the subject of our clinical trials. Precision medicine's a really new thing that's really exciting. A lot of cancers now, they will do genetic testing, and they can find out the exact DNA that's in your tumor. And then they can run a blood test on your full body and see how much of that is shedding in your blood. So they can tell just from a blood test how your cancer is doing now in a lot of ways. They can also target certain genetic markers in tumors. So your tumor has this mutation. We have this drug that can fix that mutation. And so you're cutting out a lot of the trial and error about what treatment's going to work for you and which one's not, if we can get that testing done in the beginning and see exactly what your tumor's like. So the precision medicine is really exciting. Surgery is usually the first route. If you have a solid tumor, we're going to try to cut it out first most of the time. So for breast cancer, that's typical. We're going to take out the tumor, and then we're going to give you treatment to try to clear up the rest. Chemotherapy, you all are, I'm sure, familiar with. This is the atomic bomb that we kind of drop on to kill the cancer cell, and unfortunately hurts a lot of other areas too, but it does its job. It kills the cancer for the most part. And then immunotherapy, that's a therapy where you're essentially beefing up your immune system to fight the cancer. So it's training the immune system to fight it. Not too far different from what those COVID vaccines did with the RNA vaccines. So if you are seen at UF Health Cancer Center, or you are there with a family member or a friend who's being seen, your doctor may see you, talk to you, and remember that we have a clinical trial. They may not, and so we try to do events like this, and we put up flyers to help remind our patients, hey, ask your doctor if there's a clinical trial for you. Sometimes they're overbooked, they're double booked, and they're just not remembering. So it's really great if you're interested in research to try to remember to ask, is there a clinical trial for this? We try to drill it in them to remember them, but they don't always. If you are interested and he or she thinks you may be a candidate, they will go down the hallway to the clinical trial team. We have a full team of clinical trial coordinators and tells them. That person will run to the clinic room and talk to you about it. It all is supposed to happen pretty quickly. They'll have you sign a consent form that outlines risks and benefits. That consent form does not obligate you to be in the trial. All it allows them to do is to essentially look in your medical record and find out if you're eligible because of privacy rules. We can't just go around looking in people's medical records. So we'll have people sign a consent that nothing ever happens with it. But we like to get that signed. And then if they are still eligible after we screen them, then they'll enroll in the trial. Always voluntary, can drop out at any time. This is the leakage that we see. So all the patients will come in, only about half of them will have a trial available to them that matches them exactly. Some of the criteria are pretty strict. Only some of those then will be eligible. Sometimes a blood test will make them ineligible for some other organ function. And then only a small percentage of them will enroll for a million different reasons. So we do try to identify reasons people don't enroll in trials. If it's because I don't want to go to UF 5 days a week because it requires a whole bunch of visits, there's nothing we can do about that. If it's I live far away and I don't have a vehicle and I would like to, but I can't, that's where Jen's office comes in. And we start trying to set them up with resources because we don't want anything like that to be a barrier to trial. So we're actually right now running a study where we ask every single person who we talk to about a trial, would you mind filling this out and letting us know why you're not enrolling? It's tricky because we don't want it to sound like we're trying to push them, but we just want to know. These are just some of our numbers. We have about 350 active interventional trials with about 1,500 enrolled. If you are interested in a clinical trial or you have a family member who's interested in a clinical trial, we have, so clinicaltrials.gov, I don't know if you've ever used it. It's not that user-friendly. Every trial in the United States is required to be registered there or we get fined like a ton of money. So it's on there, but it's a government website, not super easy to navigate, but it's there. We have our own specific clinical trial navigator, and you can browse by disease, and it'll tell you all the studies open at UF and who to contact. That is on the QR code on the flyers on your desk. Their website is also written there. If you don't know how to use a QR code, happy to show you. Essentially just open the camera app on your phone, hold it in front of it, and a button should pop up that you click. But the web address is actually in that brochure as well. It'll take you right there. This is the last slide I have. I know we're right at the end of time. But we talked about that first initiative that we're working on. Just in the last few years, Jen and I have been working super close, which is really exciting to get clinical trials and community outreach together. And then these are just some exciting trials that we have going on. We have trials to help with smoking cessation, particularly for women who want reconstruction after breast cancer, which is considered an elective surgery for the reconstruction. I don't know how many of y'all are aware, but you cannot, anesthesia will not perform the procedure if you're a smoker because it's high risk to do the operation. If it's a life-saving treatment, obviously they will do it because it's required surgery. But for something like breast reconstruction, they won't. And so we have this trial going on right now to help folks quit smoking at least long enough to get the reconstruction surgery that they desire. We have some vaccine trials trying to beef up the immune system again, similar to the COVID vaccines. We have those for brain cancer, melanoma. And then we have a locally developed nutraceutical, like literally it has broccoli and curcumin and something else in it, and they compounded it into a pill, and it's supposed to help with some of the side effects with breast cancer treatments with taxanes. So that's kind of fun. It's part of my job when the doctor comes to me and says, hey, I want to mix these things, and then I get to figure out how. Anyway, again, one last plug for clinical trials. Every drug we have now was tested on somebody at one point. So everybody has been affected by a clinical trial one way or another. Even an Advil was tested on somebody at some point. This is just a quote to a doctor. She turned to me and said, I didn't save your life. Those 70 women on that clinical trial saved your life. So please remember to ask about clinical trials. And that's all I got.
Thank you so much. We are at the end of our time, but if you guys are open to questions, if you're able to hang out for a few minutes, people might have some opportunity for questions. I do want to let you know that in honor of you speaking today, we will be making a donation to the Bread of the Mighty Food Bank in your name, so I will give you these certificates afterwards. What else do I have? Next week, I've already mentioned, Event Center, Youth Speech Contest. If you have not been here for the Youth Speech Contest before, it is a wonderful program, so I do hope that we will see you out at the Event Center. For our quote of the day, when you have exhausted all possibilities, remember this, you haven't. And that was Thomas Edison. And then the final piece of business is our Rotary Reading Safari raffle drawing. Number today is 632. 632. With that, our meeting is adjourned.